that.
Have I ever told you about my Christmas balls? My wife's a dentist. And
I
think I saw the dentist 6 years ago.
What?
You are listening to EMS with your hosts, Erik Axene and Matt Ball.
So today we're going to continue our conversation about our health and wellness, our THRIVE acronym.
Yep.
Right? We've talked about the overview of THRIVE.
Yep.
We talked about the TNT.
Uh-huh.
TNT.
Trinitrotoluene. Do you know that's what it stands for? TNT? Trinitrotoluene?
I did not know that.
Of
course you knew that.
Have I ever told you about my Christmas balls?
No, I haven't told you about your Christmas balls.
Nothing anatomic to reference there.
Oh, okay, got it. Because I didn't know if I had put
When I was a
graphic
chemistry
warning.
teacher,
Okay.
I would turn little cotton balls into things that would explode.
Oh.
At Christmas time, my chemistry students loved it. I basically made TNT.
Yeah.
You take the cotton molecule and you put sulfur on it with the sulfuric acid, and then you put another bath with nitric acid. So you replace the sulfur with nitro groups. Trinitrotoluene. This is basically trinitro cotton ball, and you heat up a stir stick like a glass stirring rod, and you tap it and it blows up. And so it was a Christmas tradition in my chemistry lab.
Oh, we're going to have to do that.
Well, see, that's how I taught chemistry. That's how we teach ACE.
Right.
And part of what we do here with our podcast, again, we have an education company. We make education for EMS providers.
Yep.
And that philosophy I had as a chemistry teacher with the Christmas balls, making it interesting, blowing stuff up, whatever. It made learning fun. Learning should be fun.
Absolutely.
And that's what we're all about
And I
here.
guarantee you the kids in your chemistry class probably still remember your Christmas balls.
They do.
Yeah.
It was fun. It was a tradition.
The exploding Christmas balls.
Yes.
So if you like our content, make sure to hit that like button, subscribe to our channel, and like Dr. Axene said, there's a link to our website in the description, so check that out as well. So
if you want your EMS education to be fun and enjoyable,
yeah, I mean, if
and
you want to
actually
be
mean something.
bored and death by PowerPoint, have at it, Tiger. But if you want to, why, drive a Chevy when you could drive a Lamborghini for the same price?
It boggles my mind that chiefs are still spending money, thousands of dollars on education that just doesn't matter. People press play and walk away. What we're going to talk about for the H, though, you cannot just press play and walk away here. This, like we talked about in the intro, this is some of the housekeeping items that you need to do. It's kind of like, it's nice to be able to buy life insurance or whatever, disability insurance or whatever it is.
Yeah.
And then you don't have to think about it anymore because it's all set, right?
Yeah, you're protected.
Yeah. So I think what we're going to talk about today is some of that, is just having that mindset of keeping track of certain things. It may not, like for you being a checkbox type person, very sequential. With me being more spontaneous, I'm going to struggle more with this than you.
Yes.
Because you're gonna be wanting that structure.
Annual check off done.
Yeah, exactly.
Yeah.
Do you do that really?
No. Well, like I said, in the other one is that we do it with a fire department.
Station.
Yeah.
How about dentist? Like if you see a dentist
every 6 months.
See,
Yeah. They call me and they're...
my wife's a dentist. And
I schedule it.
I think I saw the dentist 6 years ago.
What?
I know. Isn't that terrible? And my wife's a dentist.
I hope your wife isn't listening right now.
But I don't have any.
Well, she could
I think
check
I've
your
had
teeth,
one
though.
cavity in my life. And
Well, how do you know if you don't go to the dentist? How do you know you might have teeth rotting out of your
My
head?
point is, though,
Yes.
it's like I could do a better job with that.
Yeah.
As far as the H for me, the health metrics, I could do a better job with oral health, but that's not the focus of what we're talking about. But that's an example
That's
of how I
one
struggle
facet
here.
of-
You
yes.
may not, because you. But the thing is, though, what we're talking about, though, you may not be aware of some of the stuff,
Right.
To even know to put a checkbox there,
Yes.
right? So that's what we're going to talk about today.
Yep.
So I think, something that a lot of us don't think about, or maybe some of us do, is, we should be weighing ourselves consistently. I don't mean like once a year.
Right.
It's like we should be monitoring our weight.
Yeah.
Monitoring your weight should be like driving a car. Little micro corrections. If you're weighing yourself every other year, or don't weigh yourself at all, you're going to gain weight, and then you're going to have a bigger problem.
Yeah.
Literally.
Yeah.
And if you're losing weight rapidly, there could be something wrong.
Right.
So I think it's kind of like a gauge. In the gauge cluster of life, your weight is something we want to keep track of. And that's just an example of a health metric we should know.
And can I say, before you continue on, it's not necessarily about a number.
No.
Right? So, I mean, weighing yourself, yes, it gives you a number of an indicator, but it's not, because I know like on those BMI scales or those ideal body weight, like for a guy my size, I'm supposed to be like 130 pounds.
Yeah.
Like at 130 pounds, I am super skinny, like not healthily
Yeah,
skinny,
yeah.
right? So a number is important, but I think more what you're talking about is like, everybody knows when they put on a couple of pounds, like your clothes start fitting different, like, ooh, man, I've probably put on 10 pounds here. Weighing yourself, you get that metric.
For me, though, it was different. I mean, I would put on 10 pounds and I wouldn't know it.
Your clothes wouldn't fit there? Yeah, I guess.
I mean, it's like different body. Like you said earlier, everybody's different, right?
10 pounds is different on me than it is on you, for sure.
True, but I also think that some people might just be more aware of things. Where
Yes.
I mean, you're
That's
so
probably-
structured. I think like you'll be more observant than I might be.
Yeah.
Like I'll put on 10 pounds and then I'll realize, yeah, I guess my pants have been a little tighter, and yeah, I guess that it's like oh yeah, that makes sense. But I wasn't aware of it. But anyway, when you're watching that gauge of your weight. And a rule of thumb for me, go back to when you graduated high school. That's probably a weight that's pretty close to what's healthy for you.
Mm-hmm.
I grew 3 inches in college, so for me, it might be my sophomore year of college might be a good weight, and that's kind of what I'm shooting for. And I'm losing weight to get down to that goal weight. But the point is, whatever weight you are, we should be monitoring that gauge of our health. And weighing ourselves. If you don't have a scale, buy one.
Yeah.
And just start weighing yourself.
Yeah.
Same thing with blood pressure. I'm not saying you should have a blood pressure check every week, but getting into your primary care doctor and having your blood pressure checked. You're waiting at line at the pharmacy and they got a free blood
CVS.
pressure monitor. Yeah, just check it out.
And for the record, the ER shouldn't be your primary care physician.
No.
Yeah,
it's true.
just to throw that out there. Go ahead.
Yeah, but the other thing with blood pressure too is and it's not one spot measurement where we should react and get on a blood pressure med.
Right.
Right. I mean, it's really having a relationship with your doctor with multiple readings and a trend that's moving up. Maybe we should do something about it.
Right.
A friend of mine has lost quite a bit of weight, and actually his doctor is talking about taking him off his meds. He doesn't need them anymore because one of the reasons he may have been overweight is related maybe to the weight or the lifestyle somehow. So, I am not a big fan of meds.
I'm not
I
even.
hate it. That's a reactionary thing.
Yep.
But sometimes we need it
Sure.
because you don't want to stroke out, right?
Absolutely.
And while you're on that med, I would view the med as more of a bridge to fix the problem.
Right.
Let's figure out why my blood pressure is high. But in the meantime, I'm going to take this medication while I'm figuring this out. And when I fix that problem, I may not need the med anymore.
Right. Absolutely. It's like some diabetes medications, right? You lose that weight, you might not need that
Might
metformin.
not need it. Now, there are some forms of diabetes where you will be taking a medication
Absolutely.
your
or
whole life.
Yeah, you have to.
You have
Yeah, exactly.
Or you might need
different.
dialysis your whole life.
Exactly.
I mean, unfortunately, there are health issues, but fortunately, we have a healthcare system that's sophisticated that can take care of all sorts of different problems.
So you got to know fasting blood sugar.
Yeah.
Right? Your fasting blood glucose. You got to know your A1C. Like those numbers are very important. And that's why it's important to have that primary care physician. So they can look back, last year you were here, this year, 6 months ago, whatever it is.
You don't want to tell the story at the ER, and I've heard this many times. It's like, yeah, man, I've been peeing all the time. I'm always super thirsty. I've lost a bunch of weight.
check. Yeah, exactly.
It's like, you've got diabetes.
Yep.
And anyway, so that you're right. Knowing those things, and again, you don't need to check your cholesterol level every week, but knowing what your cholesterol level is, so you can make dietary modifications or exercise modifications. I mean, if your HDL's low, exercise can bring it up.
Right.
If your LDL and the bad cholesterol is high, you can change your diet to bring it down.
Yep.
And for the record, the triglycerides as part of the lipid panel, that is largely from sugar intake, not fat. So being able to understand the profile of the fats in your blood is an important thing to know. And I'm not necessarily a proponent of medications, but there are medications out there that, based on studies, have shown to increase our or decrease our mortality.
Sure.
especially with coronary artery disease. But anyway, knowing your cholesterol level, knowing your weight, knowing your,
what your resting heart rate is, what's your blood pressure. Like, I know a ballpark of where my blood pressure usually falls. I know a ballpark of where my heart rate normally is.
With these sophisticated watches that we have
super
now,
easy at least to get your heart rate.
Yeah, you can monitor your heart. You can get an EKG if you want to.
Yeah.
But I think a lot of the metrics we talked about so far could successfully do those things, with a regular visit to your primary care doctor.
Yep.
And there are other metrics you can measure too.
Oh yeah, there's all kinds of stuff.
You mentioned BMI, and that really is just a good place to start, maybe. Yeah. But most people, like we said earlier, how much did you weigh when you graduated? Right. I mean, and knowing your weight and being able to monitor things and make changes. So. And
BMI, just so everybody, body mass index, right? It's basically your height and your weight, right, combined. So. But you're a big guy. You're tall, but you're a big muscular guy.
I was morbidly obese playing football in college with a low body percent fat, but I just
according to the BMI scale.
According to BMI, and a lot of these NFL athletes, a lot of these
super athletes.
And you talked about being 130 pounds might give you a normal BMI, but at 130 pounds, you can't lift the weight you do or do the push-ups you do. I
can't. Working as a firefighter, like trying to move the things at 130, starting up at 150 pounds. Yeah, it's so I think that scale is relative, and I think that we all kind of should have at least a good idea of, okay, am I at a healthy weight?
Yeah.
Right. Now it's interesting to hear your perspective on it. Like, you wouldn't notice if you've gained 10 pounds. Like, I notice if I gain 5 pounds.
Yeah.
Like, I can tell, like, oh yeah, I bet I'm a little bit heavier than I normally am.
And then what will you do?
Oh, I'll change something. Yeah. I'll change something up.
Like you're driving, you're correcting.
Exactly. Yeah, micro turns. Exactly. And that's, we talked about this when we kind of talked about the overview, is that a lot of these health things, we talk a lot about diets. You've talked a lot about diets and paleo or vegan or, vegetarian, whatever the case may be. Hey, if that works for you, God bless you, go get it, right?
Yep.
If being a vegan is working for that person and they're happy and healthy and all those kind of things, good for you, go for it, right? But that doesn't work for everybody, right? And so I think we have to find changes that we can live with long term. It's not about a diet, it's about a lifestyle change. Right? And you've done that over the last year.
Cumulative small decisions over time. That's a lifelong difference.
Yes. How do you climb a mountain one step at a time, right?
How do you eat an elephant?
How do you eat an elephant? One bite at a time. Exactly. And so I think people, and I get this too, I work with some guys that are heavier, and they look at me and they're, oh, you're in the gym. I'm not disciplined like you. Like, bro. Yeah. Like, there's days I don't want to go into the gym. Now, once I get in there and I get moving, 99% of the time, 10, 15 minutes into my workout, I start feeling good. I've greased the engine, I'm moving, I'm feeling good, right? And then afterwards, I always feel better.
Yeah.
I always feel better. I never regret doing a workout.
Yeah.
But I'd say probably 50% of the time, like, I would much rather sit here and drink coffee and be hanging out at the smoking table in the bay with the guys telling the stories than going in here doing a workout.
Yep.
Right? I would much rather do that, or go watch my show, whatever it is.
Yep.
Would much rather be doing that, just like any other human being.
Yep.
Right? The difference is that you create that habit.
Yep.
I think in your life, like you said, you've done over the last year of working out and eating healthier, and anybody can do it.
Yep.
These guys that think, oh, I'm not like you, I'll never be like you. That's not true. You can be like that. You can
do it. Whatever it is that you do, you can be consistent.
Exactly.
And when you implement those small life changes, and we talked about this earlier, a big motivation or a big motivator can be a life emergency.
Yep.
Don't wait till you get hit, blindsided by a big health crisis.
Yep.
That'll motivate you to change.
Oh, yeah.
But I want us to empower change now.
Yeah.
And again, one of the big detractors, and we'll talk about this later with the how. We're talking about the what now, but the how really has to be implemented. The how. I mean, you'll know the right thing to do. You'll know you should check your weight, but why aren't you doing it?
Right.
You know you're a little heavy and you need to lose weight. Why don't you? It's hard to do it.
Yeah.
But we'll talk about the how later. So I'm going to poke the bear now.
Poke the bear.
I'm poking the bear.
Okay.
It's one thing to monitor the gauge cluster, right?
Yep.
But we also know that there are certain things that aren't on a gauge cluster that we have to be vigilant about checking in the car. Like, the brakes can go out. It's a weak link in the car is the, transmission, maybe, even oil changes, transmission fluid changes, all these things, brake fluid.
Coolant. Yep.
Coolant. There's certain things that wear out on vehicles, right? And in our bodies, one of the things that, we need to be aware of is the cardiovascular health. And knowing those risk factors, knowing how to keep your heart healthy. That's the weak link in our machine is the pump, the heart, and the blood vessels that are attached to it.
Yep.
And so by monitoring those gauge clusters and doing the things that we just talked about is really one of the ways we can help our heart. And like you said earlier too, Matt, is that there's so much overlap between all of these things.
Yeah.
By doing all those other things we're going to be talking about and have talked about, you're taking care of that weak link, your heart. But that's important. And I think anything you want to say about heart before I start?
Well, I was going to say,
I'm poking the bear soon. So.
What you're saying is, it sounds like you're a driver, you're an engineer, you're a chauffeur, whatever term is used, right?
Yeah.
Well, what do they do on a fire ground? They're literally sitting there watching the gauges, and they know the slightest fluctuation in intake or discharge or pump speed or anything. Ooh, we've got to make minute adjustments. Oh, I've just lost a little bit here. I got to turn my throttle up. Or, oh, I've got too much discharge pressure. I got to bump my throttle down. It's exactly what you're talking about. To put it in the context of like a firefighter.
Perfect analogy.
Is, think of it that way. Your pressure's a little bit too high. Okay, well, you got to change a little something to bring that back down, right? That's what you're saying.
And then, unfortunately, there are certain life emergencies and crises, the C word, cancer. How do we mitigate our risk for those things? Because now we're talking about when we're driving and the engine blows up or the transmission falls out, or I've seen it happen actually on the freeway, a terrible sound, and I looked over and the drive shaft had come out of the U-joint had broken or failed. Yeah. And you hear this terrible noise. Anyway, So, I have a friend of mine diagnosed with cancer and testicular cancer, his testicle removed or whatever, and that can metastasize to the brain. It's a nasty cancer.
Yeah.
How do we prevent those emergencies from happening? There are actually things we should know. We mentioned GI stuff, right? Colonoscopy.
Yep.
Let me tell you a cool story, if you don't mind.
A cool colonoscopy story?
It is a cool one.
Okay.
Not my colonoscopy.
Oh, okay.
I'll tell you that if you want, but
I'm good.
Actually, I had my colonoscopy recently, my second one, and I asked the GI doc if I could do it without anesthetic, so I could be awake to watch it. And she said, "Sure, if you want to. It might be uncomfortable." I decided not to, but I thought about it just so I could see.
Don't they record it? Can't they record? Wasn't that Katie Couric or something?
You're smarter
did that?
than me. You could record it.
Yeah.
What am I thinking, right?
Well, I think Katie Couric did it on the news live one time. Anyway,
it's really not a big deal.
No.
Well,
it is a big deal.
It is.
Have you ever seen that
It's a
camera?
huge deal. It's a huge.
It's like 6-8 feet long.
Yeah, right. It is huge.
Yeah.
But it's not a big deal.
Yeah,
but it is a big deal.
Yeah.
And what I mean by that is it's not that uncomfortable. You fall asleep, you wake up, it doesn't.
Oh, you don't feel anything.
No.
There's no recovery time. Yeah,
There are some risks that you have to sign a consent for.
Sure, but that's more the anesthesia side.
But I've had patients in the ER that come in with terrible rectal bleeding, and the CT scan shows this invasive rectal cancer.
Yep.
And this guy's in his 30s with young children and a young marriage, and now he's dealing with rectal cancer. That's
terrible.
You can metastasize to the liver, and you're not going to live long.
Yeah.
And I mean, how terrible is that, right?
It's horrible.
So I guess what I'm trying to say here is that in the fire service we have an increased risk of colon cancer, and you really should talk to your doctor.
Cancer.
And testicular cancer and kidney
Several
cancer, and
cancers,
we're going to talk about the big ones here.
Yeah.
But for now, though, this is such a preventable cancer, and if you don't know this, the colon cancers usually. Most of the types of colon cancers we get are slow growing.
Yeah.
And that's why you get a colonoscopy every 3 to 5 years, because even if you develop a cancer between colonoscopies, it grows so slow you'll catch it on the next one.
Right.
But there are people out there that come to the ER with complaints of rectal bleeding or weight loss or whatever, and I find a big nasty colon cancer. I don't want anyone to have that happen to them.
Because it's so treatable and preventable.
It's
like dying in a car wreck. Wear your seatbelt.
Right.
Yeah.
It is. It's like that.
Yeah.
So that's what the H is. all meant to signify.
Yeah.
Is these things we can do to maintain our health, these decisions that we can make,
Yeah.
a one-time decision. When I turn 45,
Yep.
I'm going to get a colonoscopy. If you have colon cancer in your family and you know it's earlier,
That's a big risk. Yeah.
if you had a dad, for example, that was diagnosed at 45 with colon cancer, then you
better
need to
start at
subtract 10 years from that and
35.
get yours at 35. If you're not sure exactly what you should do, you should talk to your doctor.
Yep.
I'm
And
not-
talk to your family. If
Yeah.
ask.
What
yeah.
if you're adopted, right?
That's the other issue. We have a good friend of ours. Can I tell you my
course you
testicular
can.
cancer
Let's
story?
hear it.
This is I'll tell myself a little bit. It almost should have been on the Embarrassing Stories podcast.
Let's hear it.
So I had actually, because we had a big cancer initiative in my department, and I had actually found a lump, and so I thought I probably ought to get this checked out, right?
Self-check, super important.
So I go to my doctor. He says, yep, we need to get you in for an ultrasound, have it checked out. So I go to the place, the imaging center, right? And I'm sitting there and I'm not thinking, but I'm sitting there and I'm looking around. I'm like, all I'm seeing is cute girls back there that are doing all the imaging. So, well, whatever, here you go. So sure enough, this young lady comes out, calls my name, and I'm like, oh man, here we go.
Yeah.
And so I go back into the little imaging room, and there's this chair,
Yeah.
right? And she's like, okay, here's the deal. She goes, go ahead and pull your pants down, and here's a washcloth to cover the part up that I don't need to see. Just leave your testicles exposed, and we'll do the thing. I'm like, okay, cool. There's a table there. Well, so she's like, I'll turn around. You get yourself all ready. I said, okay, fine. So she turns around. So I had sweatpants on. I just pull my sweatpants down. I take the washcloth and I'm holding my junk up with the rest of my junk hanging down. But I'm standing next to this bed. I'm like, okay, I'm ready. She turns around. She's like, oh, I'm sorry, honey. I mean, you can lay down. I was so
that's
flustered
so funny.
by the fact that, I was getting this procedure done. But so she goes through and she checks and everything was
was
clear.
fine.
It was all fine. It was all good.
I'm glad
But super important to get those things checked out.
know your anatomy.
Yeah,
This doesn't feel normal. What is this?
exactly.
Right?
Exactly.
And it's interesting too, and don't be lulled by, hey, it doesn't hurt, so it won't be bad. Actually, the cancers tend to not be tender, and they're very slow growing. It's actually an acute onset, wow, my testicle hurts today, and I'm feeling something there, a lump, and it's super tender. That's less concerning
Probably
than
a torsion or
You should still
something,
get it checked out.
Absolutely.
But it's more concerning for that guy that says, you know what, I've noticed this thing for a few months, maybe a year. My wife has been bugging me about it. It doesn't hurt at all, but I'm here because my wife wanted me to get checked out.
Yeah. Yeah.
And the pathophysiology of testicular cancer is it will metastasize to your brain. So we're trained in the ER, if we do find something like testicular cancer, is to get a head CT as well, and it's part of the workup. Yeah. Another common cancer, again, lung cancer is huge, especially within the fire service where you're exposed to a lot of potentially
Carcinogens.
toxic air, right? I mean, diesel exhaust is highly carcinogenic alone, and then all the chemicals in the fire that you're exposed to. I'll just say this once, but don't smoke. I mean, if you're smoking, find a way to quit. And I mean, you can't. It's water under the bridge now, but quitting smoking is a huge benefit to your health.
Good news is I don't know a lot of firemen that smoke anymore.
I do know a few that are.
Oh, I'm sure that there's some out there that do. Yeah.
So, but it's all about decreasing risk.
Right.
And
Absolutely.
mouth cancer with chewing tobacco, that's more common. Be careful. I mean, it's. I remember specifically a 35-year-old guy who found mouth cancer. He was a baseball coach, and he went in to surgery, and the cancer had gotten into the skull. There's nothing they could do. So it was kind of that made me. I mean, I've chewed before. I'm not doing that again.
Yeah.
So just be aware of that. There are risks,
Sure.
and not everybody's going to have that happen, obviously. But
Right.
it's why risk it? And
Yep.
there are safer things to put in your lip than tobacco.
Yeah.
But just to be aware of that. But all that to say is, we live in a risky world, and there's a risk benefit thing where you enjoy something. I mean, I'm not here to tell you not to do things.
Right.
Be aware of the risk, though, right?
Right.
Same thing with alcohol. I mean, alcohol isn't in something that we'll talk about with intake, but it's certainly it can hurt your body. Other cancers I think that would be good to talk about. One of the really common ones outside of colon cancer, testicular cancer, lung cancer. Another common one, prostate cancer. Being aware of the risks for that, knowing your family history, and being aware of that before you start something like testosterone, and to have a conversation with your doctor about the risks and benefits of it. But prostate cancer is a unique cancer. It's I think the statistic I read and understand is that 80% of men over 85 have prostate cancer. And they find it in the morgue. They died of something else, but in the morgue they're found 80% of men over 85 have prostate cancer. And it's a slow growing cancer. You die of something else. Now there are more aggressive forms of prostate cancer, and you should be monitored. There are blood tests you can do to monitor if you have the risk. You should get checked. Right. And there are certain things you can look out for too with prostate cancer, but that certainly is a risk as well. Yeah. If you notice blood in your urine, if it could be kidneys, it could be a lot of different things. If you notice bleeding in your
if you notice blood in your urine or your stool, you should see a doctor.
Yeah, you should.
For sure.
And there are certain common things. It could be a kidney stone. And that's not cancer, obviously. But, one of the things I've noticed, especially with firefighters and ER doctors too, is that we tend to minimize things. Oh, yeah. It's like, it's probably just this. It might be good to get checked out. Be careful. The last thing I think, as far as cancers go, that I think that, sometimes we don't think about a common cancer, skin cancer. Yep.
Especially here in Texas.
Yeah. Even T-shirts don't fully protect you. And you have a T-shirt on doesn't mean that you're protected. Right. Wearing sunscreen, wearing, wide-brimmed hat outside to protect the ears and your face and the back of your neck is important. When I mow the lawn, I remember when I was younger, I would mow the lawn with just my, tennis shoes and a pair of shorts with no shirt on and just get some sun, right? Yeah. Now when I mow the lawn, I wear a wide brimmed, like a fishing cap, like a big straw hat, and I wear long sleeve shirts and jeans with gloves. I have no skin exposure.
I wear those sun sleeves.
Oh yeah, yeah. You wear them on your motorcycle.
Yeah,
too, I've seen.
Yeah, because it keeps you cool. You still get some ventilation, but it covers up your
And it's not giving us even like my long sleeve T-shirt I'll wear when I'm mowing the lawn. The cool thing about a T-shirt is it doesn't lose its SPF protection. Exactly. Whereas sunscreen will wear off. Yep. The benefit of sunscreen, though, is it can actually increase the protection, 30, 40, 50, 70 PSI, PSF or something? SPF. Yeah. But the other thing to think about, too, is there are certain chemicals you want to avoid in sunscreens as well that can be harmful to you. So, talking to your doctor or, I'm not going to tell you what sunscreen to buy. Yeah. But there are certain...
No, I can't even wear sunscreen.
Well, it's... Yeah. When you put, and we'll talk about this with intake later, but when you're putting stuff on your skin's your biggest organ. Yep. And you put stuff on your skin, you're putting in your blood. Yep. Yep. It's the reality, right? A lot of medications are patches we put on our skin. It gets into our blood. Tattoo ink even gets into our lymph nodes in our blood. We talked about that. So we need to protect our skin. Sure. And it's a common form of skin cancer. The lower level of cancer risk would be a squamous cell carcinoma. And then you have basal cell, and then you've got the big bad boy, the melanoma, which can kill quick. And how do you monitor yourself? Well, the first thing you should do is to decrease your risk. If you're out in the sun for a long period of time, and unfortunately in the fire service, we're outside a lot. And so, putting sunscreen on and keeping yourself covered up can decrease your risk. But even if you do protect yourself, unfortunately, we live on this planet with a big old nuclear reactor about 93 million miles away that releases a bunch of cancer-causing energy, UV light. Yep. You just make sure you buy a sunscreen that protects you from UVA and UVB. Yep. And I'd make sure that it's something that's waterproof too, because even if you're not exerting yourself or in the water, we're 60% water. Yeah. It'll last longer on your skin. Yeah. And so that's the two recommendations I'd make. Yeah. But don't forget about your skin, that very important organ. Yeah. No, that's good. I think it's a good talk. The H. Yeah. Health. Get checkups, regular checkups with your doctor. They'll go over everything you need to do annually at least. Yep. It's a good way to do it.
See you on the next one.
Be safe out there.
Thank you for listening to EMS, the Erik and Matt Show.